Welcome to Medcast. Here, we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. I am Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai, and today my guest is Professor Luciano Nardo. Professor Luciano Nardo is a consultant gynecologist, fertility specialist, healthcare entrepreneur, founder of Now Fertility, managing director of IVF International. Professor Luciano Nardo, welcome to Medcast. It's a big honor to our podcast to host you, and I am sure it's going to help all the viewers who will be listening to our discussion.
Good afternoon.
Good afternoon. So the first question will be, what is the fertility medicine? So what do we want the people to understand when it comes to fertility medicine, fertility services, this healthcare industry?
So we need to make a clear distinction between fertility and infertility. Fertility is the ability to reproduce.
Yes.
So when we talk about fertility medicine, we refer to the part of science to investigate the fertility potential of men and women.
Yes.
Instead, when we talk about infertility, we talk about an area of medicine where we deal with individuals or couples that are unable to conceive. So today we are addressing the topic of fertility medicine, which will contain mostly the information surrounding the ability that women and men have when it comes to reproduce themselves.
Yes. So when it comes to those who seek the fertility medicine, so they are usually not able to conceive naturally, let's say. So this is infertility, right? So is the percentage high?
The percentage of individuals that cannot conceive is increasing. It's increasing because of many confounding factors, some related to the environment, some related to chronological age, more for women than men, some related to some infections, and also perhaps the evidence that some individuals are not as healthy as they could be when they approach the time to conceive. We have seen as well that the number of individuals and couples seeking fertility treatment is increasing for social reasons.
So is science able to help these couples now better than the previous days, let's say? The advancements in medicine right now at the moment when it comes to DNA testing and these new practices.
There have been many changes and indeed many developments in the practice of fertility care.
Yeah.
And most of these have certainly helped couples to achieve a successful pregnancy and have a healthy baby.
Yes.
But it is not 100%. Not everyone starting fertility treatment should be under the impression that they will definitely be successful. At the very best, each cycle of fertility treatment, such as IVF, could perhaps yield a 50 to 55% live birth.
Okay.
So that means that most couples may require more than one cycle to achieve a successful, healthy pregnancy.
Yes. Is it better than previous days when it started, this IVF concept?
Sure. The chance of success have increased over the years. I remember 25 years ago when I started, perhaps we were giving only 20% chance of success.
Uh-huh.
Now we, in good prognosis patients, we quote 50-55%.
Oh, that's amazing.
So the chances have doubled.
Yes.
But one thing that the public must be aware of is that naturally the chances of conception are only 1 in 4 or 1 in 5.
Oh.
So even healthy women and men trying to conceive with no underlying problems, they have every month a 20 to 25% chance of pregnancy.
So it's a very good percentage for
Correct.
fertility treatments, let's say.
Correct.
Yes.
And some couples may have a natural conception rate of 5-10% because may have other underlying problems.
True.
So for some prospective patients, the chances of success with fertility care could be 10 to 12 times higher than if they try naturally.
Naturally. Amazing. It's very good to know. So coming to the second question, now fertility. Now fertility, you are the founder, and it's a very new concept. It provides fertility services or fertility care crossing borders in different countries. So how this idea came to you, and how did you start it? Were there any challenges, and where are you at the moment?
So for 2 decades, I used to work in a conventional fertility clinic, which serves the purpose of helping individuals and couples within one location, mostly within one country, to undergo treatment. And indeed, this has got some limitations of the regulations, the law in the country, limitations in terms of access to resources, access to technologies, and of course also sometimes limitation in terms of access to treatment itself, as there could be waiting list.
Yes.
So the concept of now fertility was to revolutionize the way fertility care is available, is provided. And 3 things were important to me when I started thinking about now fertility, was to make a fertility service that is accessible, available, and affordable. When we look at the 3 A's, accessibility cannot be limited by the country, as different patients have different preferences and they have different needs.
Yes, very true.
Affordable, again, what could be affordable for one couple may not be affordable for another one.
Yes.
So in my mind, I wanted to create a network of clinics where the cost of treatment was different, so providing an affordable option without compromising on the quality and success.
Okay, brilliant. So they can choose.
Of course.
Okay.
And the third one is available. Most couples that want to have a child, they come to a clinic seeking treatment now, not in 6 months, 9 months, 12 months, or 20 months. It is not unusual in Europe that couples have to wait before they can start treatment.
Yes.
And if you are 25 and you wait 12 months, it's no problem. But if you are 39 and you are asked to wait for
1 year.
1 year,
Yes.
may be a problem. So now fertility is a concept that is closer to patients than ever before. Providing patients with a choice of treatment, choice of location, and of course, choice of price.
Yes. How does this function? I mean, which countries it is now available? And tell us about the journey of a patient, for example. From a certain country, how can he access this service?
So firstly, we will very soon be available in Dubai as well.
That's amazing.
The service at the moment is provided across a network of partner clinics that are located in the US, in Turkey, Saudi Arabia, Egypt, Poland.
Lebanon
Not,
No?
unfortunately. Poland, Italy, UK, Spain, Greece, and Tunisia.
Switzerland,
No Switzerland.
but
The head office of
Yes.
Now Fertility is in
yeah,
Switzerland.
that's why I'm asking.
But we have chosen partner clinics in strategic locations
Yes.
according to the fertility law in the country. There are certain countries, for instance Switzerland, where there is a very, very high quality medicine. But accessibility could be a problem, as well as affordability. So we have opted for a mix of destinations for our patients.
Patients, yes. So the patient, is there an application or online website or something they can go through it?
Yeah,
or
sure.
Yes.
So when it comes to the journey, patients can reach Now Fertility using various means. They can apply online, they can complete an inquiry form online, they can contact Now Fertility via WhatsApp or via web chat. They can also contact on social media. But Now Fertility developed about 12 months ago the first ever portal called Find My Fertility Clinic,
Nice.
which enables patients to go onto this portal to complete a step-by-step questionnaire, whether they live a healthy life or not, what is the BMI, what treatment they need or they wish to have.
Yes.
And based on all the questions, the portal will give them some options, some cost, and some chance of success. So patients will have all the information within 2 or 3 minutes, and they know that for the problem or the preference, they have 2, 3 or 4 clinics they can go. Mm-hmm. And they will know the chance of success in each clinic, and they will also know the cost of treatment in each clinic.
Yeah.
Once they've completed this questionnaire, a member of the team at Now Fertility will contact the patient with a view to starting the journey. The journey starts with a 15 minutes information appointment between the patient, the nurse, and the care coordinator. This is free of charge, and the purpose is to provide all the information that is necessary to make a decision.
To answer all their questions.
Correct.
Yes.
Thereafter, there will be a consultation again online with one of our fertility experts, together with a nurse. At that stage, maybe some additional investigations are requested, maybe the patient is ready to start treatment. The reason why Now Fertility offers a unique service is because, together with a number of partner clinics, we've also developed collaboration and a relationship with over 200 satellite clinics in various countries, in various parts of the world, which means that our patients can start treatment where they live or work, and they can come for treatment, the practical side of treatment, so the egg collection, the embryo transfer, the laboratory testing in the country they choose.
Yeah.
So
it's very, very comfortable for them.
It's very comfortable.
It's like fertility in your neighborhood or something.
It's cost effective. What is the real benefit to the patient? The benefit is they don't have to wait. They have one team at their disposal. They can always contact our nurses, care coordinators, and consultants. They can always trust that the experience we have accumulated in the years is made available to them without any limitation. And finally, they also know that they don't have to travel to a country and visit a clinic they don't know or they've never heard of. Because Now Fertility is also measuring and monitoring the quality of the centers we have. Yes. So they feel reassured that the recommendation, the advice, and the support is always in their benefit.
Yes, and they're receiving high quality fertility care. This is very innovative, and this is really the future. It's a futuristic idea, it's a futuristic concept. I think many fields of medicine will later try to provide similar services for their patients in various aspects, but this is really brilliant. So Now Fertility is, I think it's booming now, right? The number of patients is increasing more and more.
Of course.
What services Now Fertility provides these patients? Because we know IVF, but IVF is a broad term maybe, and under the umbrella of IVF there are many things can fall, many procedures and many techniques. So tell us more, what are the...
Now Fertility offers everything that is related to fertility care, bearing in mind patients' needs and preferences, and bearing in mind always the legislation in the country where the clinic is.
Yes.
So in the Middle East, and for instance in Dubai, we will be providing IVF, conventional IVF, to assist everyone to conceive. We'll be providing egg freezing, but we'll also be providing IVF for gender selection.
So you mentioned egg freezing, and I think this is one of the most interesting topics that I want to discuss it with you, because everyone is talking about egg freezing now. So you see ladies young and older and whatever, everyone is talking that they want to do it. And really, not everyone knows what it is. Even like healthcare professionals, I think also if they are watching us, if they're listening to this podcast, they might also benefit in advising the ladies about this concept. So tell us, egg freezing.
So egg freezing is, I think, is again part of fertility medicine. And egg freezing enables women that may be too busy in their life with work.
It's getting more and more now.
Yeah, maybe
Yes.
women that are single and they're aware of the impact of age on future fertility.
Yes.
But also women that have an unfortunate case, for instance, of cancer, breast cancer,
Yes.
or blood-related cancer,
It will be a rescue for them.
to freeze their eggs for
Yes.
future use.
True.
The important thing that I would like to say in this during this podcast is that women freezing their eggs may not need to use the eggs. They may still achieve a pregnancy naturally in the future. So the benefit of freezing the eggs is to have the opportunity to use the eggs should they not be able to conceive naturally because of anything that could happen to them
Very
in
true.
the future. So women should be even more determined and should be even more educated and even more informed to freeze eggs, which they may use or may not use, but if they need to use, then they know they still have a child using their own genetic material.
Very true. And which age you advise the women to do this egg freezing?
Ideally, the best age group for egg freezing will probably be between 25 and 35. However, it is not just a definite no if somebody at 37 comes. Equally, if someone at the age of 18 or 19
Yes.
comes. But the best age group
From the quality, probably.
for the quality as well as for the full understanding of what they're having is probably between 25 and 35. However, anyone freezing eggs should not just walk into a clinic demanding to have their eggs frozen. Should be properly investigated. Investigations entail an ultrasound scan of the pelvis to look at the ovaries and count the number of follicles inside the ovaries,
Yes.
because that
So
is
it's a medical investigation.
Correct.
I thought it's another investigation.
that is a good prognostic indicator
Yes.
of how the ovaries work.
Yeah.
They should also have a blood test for a hormone called AMH, which stands for anti-Mullerian hormone, which is also another marker of ovarian function.
Yes.
So prior to starting the treatment, some investigations are required. And apart from a consultation with a fertility expert, they should also have an ultrasound scan of the pelvis, and they should have a blood test for AMH.
The procedure itself.
The procedure is very simple. And again, there might be some differences between cultures and between countries. But generally, women embarking on egg freezing, they will be taking some injections with very, very fine, small needles for about 12 days. These are hormones, very safe, hormones that women already produce, so they're not taking anything different.
Of course.
They're not going to have significant side effects. They're not going to put weight on. They're not going to become depressed. The benefit of taking the injections is to ensure that the ovaries produce more eggs
Yes.
in any one time.
Yes.
The eggs are then collected. During the time the women take the injections, they will be having some ultrasound scans to assess how the
eggs.
how the follicles develop over
Yeah.
time. Eggs are contained within the follicle.
Within the
So with the
follicles, yes.
ultrasound scan, we can assess the dimension of the follicles and how the follicles develop over the course of the 12 days.
Okay.
Once the follicles are mature, then a final injection is given. This is called trigger injection, that enables the mature eggs to be released from the follicle's walls in the middle of the follicle. And at that stage, an egg collection is performed. The egg collection can be performed using different techniques. In very
Wow.
rare,
Really, I had no idea. Wow.
very rare cases, could potentially be performed by transabdominal ultrasound. The other possibility is to perform the egg collection transrectally. Again, is not commonly performed, but it is proven to be a solution which overcomes the need to
Transabdominal.
to go through the vagina.
Yeah.
So transabdominal and transrectal are non-common but possible avenues that are explored in women that are not sexually active, or in women that may have other underlying reason for which transvaginal is not possible. But in the great majority of cases, the procedure is performed in the space of 10 to 15 minutes maximum in a procedure room with sedation by a fertility specialist with the help of a fertility nurse and an anesthetist as well, transvaginally.
The patient can go home on the same day?
Yes. Certainly the woman undergoing the egg collection will be ready and fit to go home within 2 hours from the procedure.
Yes, brilliant. Where are the eggs frozen? In each country or?
Sure. The eggs, once the eggs are collected, the eggs that are mature, because not all the eggs are mature and not all the eggs that are collected are suitable for freezing, but once the eggs are collected, they will be put in culture by the embryologist in the laboratory for a little while, and then the cells surrounding the eggs will be removed and the egg is deemed to be mature or not. The mature eggs will then be frozen, and normally are frozen within the same clinic where the procedure is carried out.
Okay.
There are, of course, options. Sometimes women that may be moving from one country to another one can apply for the transport of their eggs. Say, for instance, from Dubai to Madrid. There are sometimes some restrictions, and there are, of course, sometimes also some procedures to follow. With a very cosmopolitan world we live in now, women as well as men, but of course at this stage we're talking about egg freezing, so will be women, they tend to move from one country to another one. Sometimes it's important that they receive adequate legal advice.
Yes.
So actually we at Now Fertility have also established a partnership with a law firm with expertise in human tissue that can advise patients about the possibility, the practicalities, the legal constraints. Sometimes
each country, because as you mentioned, each country is different.
Of transferring
and transferring
eggs in this case from one country to another one.
So the freezing is something need to be licensed, any licensing or?
The freezing, yes. Obviously, the whole process is carried out within a licensed institution, so the clinics have to be licensed. The clinics, most clinics will have some key performance indicators, so they know the survival rate of the eggs once the eggs are thawed out.
Yes.
The important thing for our audience is, although we are talking today from Dubai, where women can freeze eggs freely, but no other countries or not many countries in the Middle East
can do that.
Yes. But in Dubai, for instance, women can keep eggs frozen and they can pay an annual storage fee. But there are countries where women can only keep eggs stored for a certain number of years. So this is another reason why
an issue also.
This is another reason why it's important to advise patients when is the optimum age to freeze eggs.
Exactly.
In the UK, for instance, women could store eggs for a maximum of 10 years. That was some years
In
ago.
Dubai?
There is no limit. There is no limit.
That's good. Yes.
So that means if you were freezing your eggs when you were 20, you could practically only use them up to the age of 30 when you're still young and fertile.
Yes.
So that's the reason why also choosing the age between 25 and 35 is optimal.
Yeah, that's optimal.
So you got some
Time.
time.
Yeah, well, it is harder. Above 35, of course, it's harder. So
when women seek advice about freezing eggs, if not in Dubai, and they look at other destinations with us or with any other clinics, should also be aware of what is the storage period allowed by legislation in the country.
yes, very true. A question like a bit maybe not easy to answer, but is it affordable, or it targets certain socioeconomic class?
It is very affordable. If you take into account the cost of living and sometimes how much women spend on holiday and going out and buying a handbag or buying a car or buying a pair of shoes.
This is very important, of course.
The cost in the UAE, in Dubai, the cost of an egg freezing cycle, including medications, is around 20 to 22,000 dirhams.
It's very reasonable, yes, because it's also a journey, and it's very reasonable.
And the annual cost of storage to keep the eggs in storage within the clinic is around 2,500 dirhams per annum,
which is also reasonable, in my opinion. Thank you very much for this, full understanding now for, I think, all our audience and including myself about this very important topic. So, this industry is growing, it seems, and this probably encourages people like you to invest more and do more. What about the industry of fertility care?
The fertility care industry has grown massively in the last decade and is expected to grow even more in the next 2 decades. I remember very well when I started as a junior fertility doctor, we were only doing fertility care, fertility treatment for couples who could not conceive. Whereas now, I would say probably less than 50% of couples coming to a fertility clinic, they cannot conceive. Most couples, they can conceive but may not want to wait. Some may have some underlying problems. As we said earlier, they may want to have a healthy child. And the only way to have a healthy child would be to do IVF and genetic testing of the embryos before transfer. But there will be also men and women wanting to freeze sperm and eggs respectively. Across the world, fertility care industry has grown and will continue to grow as there is a huge demand for that. In the region, there is also be an increased interest for IVF and fertility care, sometimes because of consanguinity. As we know, when there is a consanguinity in the marriage, then there is an increased risk of genetic disease for the offsprings. So IVF is not going to remove the consanguinity. IVF is not going to remove the genetic problem, but IVF will enable the couple to have a child, possibly without genetic disorder, because via genetic testing, we can test embryos and select the healthy embryos for transfer. Yes. So we have the advantage of using pre-implantation genetic testing together with IVF in order to choose healthy embryos.
So now, at the moment, you are able to select the healthy embryo, and this opens the door later on for genetic treatments, where maybe some embryos can be treated if this science will be into practice.
Of course. So practically speaking, we cannot treat the embryo, but we can change the DNA of the embryo, or what's going to be an embryo.
Yes.
At the very, very early stages, when eggs and sperm are put together.
Oh,
so,
nice.
Once the embryo is formed, at this point in time, there's nothing we can do.
Okay.
We can only select the healthy embryos for use.
Okay.
However, if there is a problem with the genetic material of the egg, it is possible. Depends of the country, depends on the legislation, and also at the moment it's just research-based to change that genetic material so that we don't have to make an embryo using a genetically abnormal egg.
Brilliant. That's great. So now I will ask you about the awareness. How do you find the awareness among the population in general in different countries about fertility medicine? Do they have any idea, or they come to you really without any idea? Anyway, this is your role, but it's good to really spread the awareness for even the young generation to know.
We are very fortunate, we as a public, because in this day and age there are many ways to disseminate information. Education in the past used to be by your physician, maybe your primary care physician, maybe secondary care, maybe your tertiary care physician. But in this day and age, there are many patients' organizations. There are many resources that women, men and couples can access to educate themselves. So awareness doesn't come as used to be only from the doctors, from the physicians. I think awareness now is coming from a different level of education, from a much bigger access to resources, but also from direct patient experience.
Yes.
There are many patients that are without an incentive happy to share their stories, their experience, and that is certainly serving a positive cause, because other patients, they feel encouraged, they feel empowered to follow the same journey.
Very true. Your final message to the people who are listening to our podcast, what will it be?
I think one thing I always say is fertility care is a very evolving or fast evolving part of medicine. Undergoing fertility investigations should not be seen as being labeled with an underlying problem. I think undergoing fertility investigations is making an informed decision sometimes, if and when to start trying to conceive, or indeed freezing your eggs or sperm. So do not be afraid of seeing a gynecologist or walking to a fertility clinic asking for a fertility test. Sometimes you may find out of a problem that one day could be a limiting factor to your ability to conceive. In some cases, sooner you find out, perhaps more options you have. And for those that are undergoing fertility treatment, my message is don't give up, because we know that fertility treatment is daunting, is sometimes putting lots of pressure on the individuals and the couples, but the majority of those trying to conceive with fertility treatment, they are going to have a baby. May not be in your first attempt, second attempt, third attempt, but only by trying and keep trying, you have the best chance of success.
Thank you very much, Professor Luciano Nardo. We spoke about fertility medicine, and I want really to thank you as a fertility specialist, as you and all our colleagues in this field of medicine, because at the end of the day, you are helping the couples to achieve one of the most important dreams that I think most couples would like to have, which is the dream of having a baby and raising a child. And thank you very much for being with us today.
Thank you very much, Dr. Wafaa.
Thank you.